sasubmit na kami ng aming summary ng mechanism of action. Yun ang kailangan ng Minister of Health ng Abu Dhabi.
Prevent the initial, is it spike protein? Does it interfere with the spike protein on the coronavirus?
Yeah, actually, the spike detached. So the lock and key mechanism is already altered.
Yeah, okay. Great. So that's clear to me. I understand this. Now my question, because I'm really ignorant in the rest of the virology field, what would happen if you treat and the virus already a portion of the virus or a titer of the virus has already entered the cell? So your cure would be only to prevent new viruses entering the cell, but does it do anything to the ones that have already entered the cell?
Okay, that's where the valid. No, I will answer that, doctor. In the validation, we have what we call selective toxicity, meaning this drug affects or attacks the virus itself as well as the infected cells. Whereas the normal cells, this technology is friendly. It does not affect the normal cells. It's only the virus and that's what we call the selective toxicity, where our validation stands.
Okay. So I think, do you have any questions, Dweta? No?
Yes, doctor?
Yeah.
Yeah.
Do you have any questions?
No.
Okay. Then, Dr. Fabunan and the team, I initially read your initial submission to our management, as I said. I think what we need from you now is just a simple proposal for the mechanism of action that you described for your drug to be submitted to us, and then we will go from there. We'll give our own comments to our management, and hopefully, if there is anything positive, you will hear from us soon. Okay?
Okay. Yes. Thank you very much.
Thank you. You have our email there, Rohan. You have
Yes,
our
doctor.
email?
Yes, I will coordinate with all of them.
So I just need a brief description of what Dr. Fabunan described earlier.
Now the virus, how the drug prevents or destroys the lipid bilayer of the virus, and that the prednisone. No, you said dexamethasone, right?
Yes.
Yeah. For the Novocaine or the anesthetic that is attached to it. Just give me, that brief description of the drug, and we will take it from there, inshallah.
I will get that organized, doctor. I will get it organized and share it with the rest of it.
Thank you. And if you have any, Dr. Fabunan, have you come across any side effects from the patients that you have treated in Philippines or any other parts of the world?
Yeah. So far, doctor, the side effects that were the negative side effects for this technology, we haven't encountered a major side effect for that matter. The side effects that we're encountering so far is sometimes hiccup or lightheadedness, which is all those related. Those should be given in a proper amount, the frequency. No allergy so far.
How many doses, how many injections? One only, or we follow that up?
No, doctor. It depends upon what disease you are having. It depends upon what kind of disease the patient has.
Yeah, we're talking about,
COVID-19.
yeah. So how many doses would you give me if I were to be diagnosed with COVID-19 by PCR?
You were giving 6 injections divided in 3 days. 2 shots. Okay.
6 injections over 3 days. Okay.
Okay. And it depends upon the severity probably. And my experience is because I have only a very limited COVID patient one. Other patients probably the patient is in more severe condition. Probably we can go as far as 5 days.
Twice daily, right? Twice daily for 5 days.
Yeah, twice a day for 5 days. Depends upon the, you know, for viral diseases, we are also very particular with regard to the clinical aspect, the clinical side of the patient, okay? How you assess the patient.
Another question I have, just immediately, does that preclude the standard care that has already been in place? I mean, if I am a COVID-19 patient, then should I stop what the hospital is giving me and just rely exclusively on your treatment? And I should be fine within 5 days or 6. Is that
In
a
my
statement to make?
in my opinion, because our technology can stand alone. Meaning, you can stop probably other medicine for us to say that Fabunan antiviral injection is the sole medicine that can give the improvement with the patient. Okay? With regards to probably if the patient is confined and needs some oxygen therapy, if you can continue those mechanical devices.
Great. So please include this in your summary, Rohan and Dr. Fabunan. Include these things, the no side effects and the regimen of treatment, how many times you treat and the severity of the disease, so that we can have our own, an internal evaluation for the lab. Okay, sir?
Okay,
Do you have any questions from us?
from your, yes, doctor. From your country, how do you assess the situation with regards to COVID?
Yes, there is several layers. Right now, for example, we're trying phase 3 clinical trials for a COVID-19 vaccine in conjunction with Sinopharm. We made this public. And about 15,000 patients will be involved, or 15,000 individuals will be enrolled in that program. That program would not have been in effect had it not been for a very well-established committee that looks at COVID-19 treatment and vaccine development and vaccine use. So there is a very well-formidable committee which is made up of several backgrounds of expertise from the field of either clinical medicine, clinical research, basic science. They are about 15 to 20 individuals. They look at the ins and outs of the actual procedure, the actual components of the vaccine, and then they give their, scientific feedback to the higher management or to the decision makers. This is one layer. Another layer is already in our stock house, is the operating arm. They are carrying out clinical research of different products, and sometimes they come up with contradicting claims that the original company claimed or made. For example, hydroxychloroquine is a very popular one. It has been stopped, and I think another I forget which one. Another drug was used and then had been stopped because simply it did not show any effectivity or efficacy in our patients. So our own operating healthcare facilities do carry out individual and independent clinical trials, but yet through our major committee that I described earlier. And the final, the final answer and decision is our healthcare leadership. When they are convinced of something, they will do it. And if they are not, then no science behind it, they will not. So this is basically, the process. I hope I answered you, Dr.
Yes. But can I ask one more question, Doctor?
Yes.
Yeah. With regards to vaccine, how about infected patients? Do you agree that vaccine no longer be effective or useful with regards to patients who are infected with
Yes, I agree with you. Scientifically, scientific statement, and it's very logical statement. Usually, the vaccine for prophylaxis, not necessarily for treatment, right? For people like we were given the polio. For kids, we didn't polio then, but alhamdulillah we got because
which are included in the trial. Are you aware actually the mechanism of action of those drugs?
the ones you mean in our phase 3 clinical trial?
Yes, yeah, for example.
Yes. It's actually done through a very, let's say, government operated conglomerate and consortium, and the majority of people who are there, they are experts. One of them has been already in our healthcare facility, and then he moved up to become the advocate for this, and the scientific method of the phase 3 clinical trial drug itself, how inactivation has been installed or done, whether using UV light or other methodologies. All of these nitty-gritty details have been described very clearly and very, eloquently, so that even, the decision makers or scientific people can read it and understand the ramification of the drug itself or of the vaccine. Yes, we have asked all these different detailed questions.
So comparatively, have you heard this Fabunan antiviral injection?
I heard it from you today. Before it was just the one that you sent, the document that the PDF file that you sent to the management. I read that one, but I didn't understand the details. You described it very, very methodically, and I really appreciate that. Now I have a clear idea about what Fabunan injection is. So I have an idea about it, and you justified why you use each component of it, which is what I need, and we'll go from there, inshallah. Okay?
Thank you.
Questions, yeah?
Wow.
I think all satisfied, Doctor? All angles satisfied?
Satisfied because I have met you, Seth, and met your team. This is the benefit of virtual meetings, because you get to meet people 10,000 miles away from you.
Yeah.
And you learn from them. Good.
Thank you, Dr. Rashid. Thank you for the time. Thank you, Amna. Thank you, Maita. Thank you, Dr. Fabunan. What I will do as the main coordinator of this entire group is I will work closely with Dr. Fabunan to get this summary of description that Dr. Rashid wants, and I will share with the team the science, the side effects, the treatment, the results, the administration and all. We'll put a small document together and we'll share it with your team, Amna.
Thank you.
Specifically, okay?
Yes, specifically Dr. Fabunan for COVID-19. Let's work only on COVID-19 for now.
Yes, exactly. This is the document, that was shared with us. It says the cure COVID treatment. That's your document.
Yes, doctor. Yes, doctor.
So that's the only discussion we are having. We don't have any discussion of other treatments. the focus is on COVID-19, and that's why.
Yeah, presently let's look at COVID-19, Dr. Fabunan. So the other parts can always be put into place once this is addressed, which is the main requirement.
Absolutely, sir. Absolutely, I agree with you. Thank you.
Thank you very much.
Any other concerns?
One more question, Doctor. Again, sending our million thanks for accommodating us
Thank you, sir.
and giving our technology, presenting our technology to your beloved country.
Thank you, sir. When the flights are open, we welcome you here if you want to pay us a visit. Okay?
Hopefully,
Okay.
Doctor.
That is the next step, very much important, I guess.
Yeah.
Okay.
Thank you, sir. Thank you, Thank you, Dr. Fabunan.
Thank you po. Thank you.
Thank you so much, everybody.
Thank you.
And
God bless you. And the Filipino, they say in Tagalog, balik po kayo, right? Balik po kayo.
Yeah.
Okay.
Hindi simple yung Tagalog Filipino language, Doctor.
Yes.
I think the next meeting, Dr. Rafet is in Philippines.
We'll do it in Tagalog, huh?
Men in your kingdom, okay? And our regards. Okay, thank you very much.
Have a great day, sir. Thank you.
Thank you.
Salamat po.
Thank you. Salamat.
God bless. Bye.
Bye.